Zimbabwe now, where Doctors Without Borders and water and sanitation experts have developed a highly effective environmental toolkit to control outbreaks and prevent reoccurrence of waterborne infectious diseases in that country. Several damaged water points were repaired, new boreholes drilled, and community health clubs set up last year. To tell us more then is Bjorn Nissen from Doctors Without Borders, who joins us via Skype. Bjorn, good afternoon. Thank you for joining me. So tell me first about the risk that has led to you developing this toolkit. What are your worries about water safety in Zimbabwe? There is a history and a context to it all, isn't there?
Yes, there is. So we know that to fix it at the macro level, to provide the clean, safe water from the city through the normal infrastructure would take a massive investment. And meanwhile, we need to look at short to medium-term solutions. And we saw that by not going deeper and not providing new and improved solutions, we would just be facing the same problem year by year. So we decided to develop new tools.
So, I mean, part of the context is that there have been outbreaks of cholera, the worst one, of course, being in 2008, but we've also seen outbreaks of typhoid. How important, then, is groundwater and the safety thereof once you've drilled, for groundwater in various areas of Zimbabwe?
So what we are seeing is that in an urban context like we have here, especially in the high-density areas, the shallow aquifers will be contaminated by all the sewage pipes who are broken, by waste on the ground, by spillage water. So it's sinking down, so you need actually to go down maybe 50 to 60 meters to reach another layer of aquifers which are not directly contaminated. And what we are doing, which is new in our context here, is that we are providing a super seal on the top, which could be 15 meters of cement around the pipe going down. And this protects the water source from being contaminated from the shallow aquifers. And this is a key investment in the short to medium term, because this is where people are getting the water from. But we need to make sure we go deeper and we make sure that we get access to clean water, that we don't contaminate again by linking it with the other aquifers, which is higher up.
So in a way, the problem was a bit of a vicious cycle, wasn't it? In that people were turning to groundwater and boreholes because there is no water coming from the government infrastructure. But then the boreholes they were drilling and the groundwater was being contaminated because systems such as sewage systems were failing.
Yes, it is a problem that will repeat itself. Now we are lucky we did not have cholera since the end of 2018, where we had the last big outbreak with 10,000 suspected cases. We still have a few sporadic typhoid cases here. But for sure, if the main reasons for the outbreaks, the triggers, are not fixed, it will continue. So we, as a medical humanitarian organization, we needed to look around to make sure that we have an approach which is adapted to the context. So vaccination is another tool that we need to look at. We are looking at community monitoring. We are looking at technical solution with the water drilling, as I told you now. And together, this kind of saturated approach should be enough to put a ring around any new outbreak, and to stop production at the outbreak of at the beginning of the outbreak.
Sure. Lastly, Bjorn, talk to me about your efforts to drill more boreholes. Where are you focusing those? Right now, we've been talking about your efforts around the capital, Harare, and the high-density suburbs there. But where else are you drilling, and what areas are your main focus?
It is the focus is on Harare for the moment, but what we know, for example, Chegutu in 2017 had an outbreak of cholera, and there we reached the same challenges as other places. That the infrastructure was from the late 70s, early 80s, with not a lot of maintenance, which means that you have potentially a lot of places that could carry the same triggers for an outbreak in Harare due to lack of maintenance. And of course, now we had Harare being vaccinated last year for both cholera and typhoid. So we may have a smaller risk here and a higher risk in other smaller urban centers around the country.
All right, Bjorn Nissen from Doctors Without Borders joining us via Skype from Harare, where they are working to respond to the water challenges there and the threat of waterborne diseases. In